I had a patient recently that was basically ostracized by her provider for going to Dr. Google to try to find solutions to her health problems. And there's this common attitude from providers that my patient was looking at Dr. Google again. And there's this sort of negativity toward that I just want to say I don't agree with. If your patients are coming in educated and curious about their condition, and they've looked through the sources online, that some are totally not legit and some are. But as a provider, I think it's our job as providers to help our clients determine what is helpful and what is true and what is not, and what relates to their condition and what is not. And I almost think this posturing against Dr. Google is more about the practitioner not having the time or the breadth of knowledge to sort through that with their patients. I think it's a really great sign when my patients have been researching about what's going on their own, because it means they're invested in getting better, and they're curious, and they're wanting to be involved in the process. And I love that. I think it's fantastic. And if I, as a provider, if a patient brings something to me that I've never seen before, or because this is a huge age of information, there's so much out there. There's providers don't know everything. So if something's brought to my attention, I want to look into it and learn about it and be able to sort through it with my patients. So don't go to Dr. Google and freak out about, oh my gosh, it's probably this condition, and don't let it be a source of fear for you. But if you feel empowered when you do your own research as a patient, I think that's fantastic. And I think that we as providers should help you to understand it and to go, does this relate to me? Is it going to help me or not? So just my quick 2 cents on Dr. Google. Bring it on, bring in anything that you learn, and I will happily sort through it with you as a provider who, understands that we're all always learning and growing. And I learn more from my patients than I did in PT school, honestly, because these are real humans with real experiences, and nobody's a cookie cutter. Nobody is a clone of another person. We each have our own history and our own story. And maybe Dr. Google will give you some insights that'll steer us in a direction we might not have otherwise looked. Be well.